So I'd like to talk about medication-assisted treatment, which is also referred to as MAT or MAT for short. And medication-assisted treatment is a combination of both medication as an intervention and behavioral interventions with addiction. And the behavioral interventions, we're basically talking about counseling, outpatient counseling or residential counseling, but any form of behavioral tool that you're using in addition to the medication. Medications are useful for addictions in the same way they're useful for all sorts of other diseases and afflictions. They help to stabilize the body and treat symptoms that the people are experiencing. So when you have addiction or substance use disorder, your body has gone through a whole lot of trauma. It's been affected by the substances that have gone into it. And typically when somebody is trying to recover from addiction, they're going through what's called a withdrawal process. So when you remove all of those substances that you've been using, your body is kind of going into a shock that it doesn't have those substances anymore. And the body can't naturally make the chemicals that it used to because it's used to having those synthetic substances put into it. So now we need to do something to stabilize the body, and that's where medication comes in. And it helps alleviate that withdrawal. It helps comfort the person and allow them to be able to engage in other pieces of their treatment. So if I'm stable physically, then I can go to my counselor's office and I can sit through an hour of therapy if I need to. So in that way, it is helpful both physiologically for the body, but also psychologically for that person to continue on the road to recovery. And MAT medications are approved by the Food and Drug Administration, so they're heavily overseen and regulated by our federal and state governments. Now, why medication-assisted treatment? I talked a little bit about this, but it does help stabilize that patient or client in order to engage in other treatment components. It also helps with, quite frankly, patient survival. The sad truth is that nowadays, a lot of the substances that are on the street right now are extremely fatal, or at the very least can cause overdose and very scary situations. So medication-assisted treatment allows a patient to stay in treatment and not be exposed to those substances that are on the street and might be laced with fentanyl, which is a highly dangerous substance, or other substances that can cause overdose or death. It also decreases illicit drug use. So if I'm using a prescribed medication by a doctor to stabilize my body and help me on my path to recovery, I'm less likely to go use illegal drugs, which can cause all sorts of issues, not only to my body, but also criminal activity and other social problems that we want to help people avoid. Medication-assisted treatment also helps with birth outcomes. Nowadays, there are a lot of pregnant women out there that are stuck in that addiction as a disease cycle, and they don't know how to get out. And sadly, even learning that they're pregnant is not enough to battle that addiction, that cycle that they're in. So the medication can help stabilize the mom, and it also helps stabilize the fetus, so that when the mom gives birth, the baby is much more healthy and has a much greater likelihood of survival. Medication-assisted treatment also addresses infectious diseases. So we know that a lot of times substance use and addiction comes with other diseases like HIV or hepatitis C, and those are spread through addiction communities. Well, by using medication-assisted treatment to keep people off the streets, we're also lowering our rates of those infectious diseases. So what are the various substances that we can use medication-assisted treatment for? I wish that we had a medication for every single substance out there. We don't right now. We have it for 3 different substances: opioids, alcohol, and tobacco. And I say tobacco, and everybody usually recognizes we've done that for a long time. We have things like nicotine patches and nicotine gum, and we'll talk about that in a moment. But medication-assisted treatment is not a new concept. So let's start with opioids. For opioid use disorder, there are 3 medications that we use: methadone, buprenorphine, and naltrexone. And methadone is the longest history of those 3 medications. It began in the 1960s, and it's dispensed at very regulated clinics or dispensaries in all of the states of the United States. It requires 1 daily dose, so you go in and you take your methadone, and it eases your withdrawal symptoms, and it has all the benefits that we've already talked about. It's especially effective for severe opioid use. It's also effective for somebody who really craves and needs that daily structure. If going to a counseling or a treatment center one time a week is not enough, you need that daily contact with somebody to help motivate and keep you accountable, then a methadone clinic, or what's now called an opioid treatment program in Indiana, is likely the best option. Some people do criticize methadone. They call it substituting one drug for another. It's important to know that that's not the truth. Heroin and other opioids are very short and fast-acting opioids. Methadone is a very long-acting medication. So when you're using illicit drugs, you're getting that quick up and down, peaks and valleys, and that's what causes the craving and the addiction cycle. When you're on methadone, it's like any other prescription drug out there. You're stabilized at a very level pace, and your body is not reacting severely up and down to the medication. It's very long-acting. The other criticism is that patients are getting high. We just talked about that. It's not a reaction like you would get from heroin or other opioids. You don't even feel that you're on methadone. It basically is just keeping your body stable. Another medication is buprenorphine, which is often known as Suboxone. That's also a daily medication, but it doesn't require visiting a clinic on a daily basis. Prescribers can prescribe it to you for certain amounts of time, often 30 days at a time, so you can engage in other treatment components like your counseling, whether it's individual or group or your community activities, and you can visit your physician's office maybe once a week or once a month when you're more stable, and it's more convenient in that way. It is not as good for more severe opioid use disorders like methadone, but it does handle the majority of folks suffering with opioid use disorder. And finally, there's naltrexone, which there's an oral version, and there's also an injectable version, which is known as Vivitrol. And it is a non-addictive and very difficult to abuse medication. So it does have all the same benefits of the other medications and some additional benefits where it is not as valued on the street as the other two can be. Now, the only difficulty with naltrexone is you do have to be abstinent from substances for 7 to 10 days before you can take it. So whether it's oral naltrexone or Vivitrol, you can't take any opioid substances until you start these medications. So that window of time can be difficult for somebody attempting recovery. A quick note again on MAT in pregnancy. Opioids during pregnancy is very dangerous for the unborn child, so MAT does stabilize the fetus, and it is proven safe and very effective for both the mother and the baby. So the second category of medications is for alcohol use disorder, and there are 3 medications that we use pretty regularly: disulfiram, acamprosate, and naltrexone. They have some more common known names, the first one being Antabuse, and that's an aversion medication. So you take that medication on a daily basis, and then if you do drink alcohol, while you're on that medication, you're going to have an aversion to, you're going to have a bodily reaction to it. It could be a wave of nausea, it could be true vomiting, it could be just facial flushing. Whatever the case is, that medication is helping you understand that your body does not want the alcohol, and you learn over time not to take that risk of getting sick while you're on the medication. Another medication is known as Campral, and it helps reduce craving and relapse. It's interesting, we're not exactly sure how it works, all the mechanisms behind it, but it does have several studies that show that it is effective for alcohol use disorder. And then naltrexone, we talked about this with opioid use disorder. It's also used for alcohol use disorder. So the same oral naltrexone or injectable Vivitrol can be used for somebody who's struggling with alcohol use. And it has the same benefits. It reduces cravings for alcohol, and it's taken either once a day or once a month. But same thing, if you're struggling with both alcohol and opioids, you cannot take opioids for 7 to 10 days before starting that medication. And finally, we have tobacco use disorder, and we use nicotine replacement. We use bupropion and varenicline, and those have some brand names as well. Now, nicotine replacement is used as a harm reduction tool. So instead of smoking a cigarette, you're maybe wearing a patch or chewing on gum or sucking on a lozenge or using an inhaler. It comes in all sorts of forms, but you're getting the nicotine in a healthier way as opposed to inside of a cigarette that has all the other carcinogens and chemicals involved in it. It's supposed to be used short term and help you wean off of the nicotine replacement to entire abstinence. Now, more commonly known as Zyban or Wellbutrin, this next medication does not contain nicotine. It's not a replacement medication. It just helps with your cravings and withdrawal symptoms. And you start taking the medication a couple weeks before you're going to quit smoking, and then you continue using it for at least 7 to 12 weeks prior, and some people use it all the way up to a year after quitting smoking to help with those continuing cravings. And finally, what's known as Chantix also does not contain nicotine, and it neutralizes the effects of nicotine. So if you do smoke while you're on the medication, you don't get the same bodily reaction to it as you would without the medication. It's usually taken for 12 weeks and might be prescribed for another round if needed, but it's another option for tobacco. So something that's important to talk about with medication-assisted treatment is that it's not just the medication. Like we talked about, it's also behavioral interventions. It's also counseling, skill development. And when I talk about skill development, I talk about how to write a resume, how to go interview with an employer to get a job. Maybe it's as simple as how to do some house cleaning at home and get some help with how to take care of my house and my children. A lot of these skills were either never developed because the addiction's been around so long, or people have sort of forgotten how to do those skills and need some help getting back on track in life. Also case management, so that can look like help with attaching to other resources in the community. Insurance navigation, maybe you don't have insurance, or maybe the insurance you have doesn't cover the kind of treatment you're looking for, so maybe you need help finding what resources are out there that can attach you to the right treatment that you're looking for. A lot of people need housing help when they're suffering from addiction. They may have lost the ability to pay for their housing, or other people are having difficulty living with them, so they've found themselves in situations that they don't have stable housing, and we need to help with that. Employment services, other medical services, because quite often people in addiction do not stay up on their medical services, including dental and other preventative appointments, so we need to help with those as well. Mutual help group engagement, so that means a 12-step group. There are plenty in all of the Indiana communities, and they're highly successful, and we need to help get people attached to those as well. And never forgetting spiritual engagement. This is a huge component of recovery for a large percentage of people in the recovery world, and it's very important, and we need to involve churches and other spiritual organizations that can walk beside folks in recovery. So finally, I just want to talk about MAT success. Medication-assisted treatment has been shown in the first long-term study of its kind to have extraordinary success. 50% reported being abstinent or without substances entirely 18 months after starting their treatment. After another 3.5 years, that number of abstinent patients, it didn't go down, it rose. It means that more people jumped on the board of recovery the longer time went on. And after 3.5 years, less than 10% met criteria for substance use disorder. So that means if you go to an office and you're getting diagnosed with a disease, less than 10% of these folks in this study were diagnosed with addiction anymore because they had entered the road of recovery and were seeing success. So medication is a very effective component of treatment. It's very often a successful tool for a lot of folks. And I highly recommend seeking out resources that can help you with it. And if you do need more information or resources on this, visit lookupindiana.org.